South Africa's healthcare challenges were high on the agenda at the 21st Annual Board of Healthcare Funders, currently underway in Cape Town. The event that started on the 17th of May will conclude today. I'm now joined by Dr Katlego Mothudi, who is the Managing Director of a Board of Healthcare Funders, to unpack in detail some of the challenges facing healthcare system and possible solutions. Dr Mothudi, thank you so much for speaking to us this afternoon. I suppose the first question would be around, were all the concerned parties present at this event?
Yeah, thanks, Hugo, for having us. We definitely had a wide array of delegates, ranging from captains of industry in the funding environment. We had government officials, various registrars and regulators, and not just confined to South Africa, but from the region as well. So I could say that there was a fair representation of all the stakeholders.
Now, I'd imagine that one of the things that you were looking to do was certainly come out with achieve certain outcomes post the conference. Have you been able to achieve this? And what was it that you were seeking to achieve?
So we had very good discussions, and these were premised on what we thought we need to do to strengthen the health ecosystems. We contemplated the WHO template that talks about the 6 areas that need to be looked at when you want to shore up your health systems. And this range from leadership and governance, issues around service delivery, issues around healthcare workforce, access to essential medicines, etc. And I believe that each of these topics did receive quite a fair amount of attention. There are still, I would say, many areas that we need to contemplate. You will acknowledge, Hugo, that healthcare systems were challenged before COVID. It made situations maybe worse, did not remove what we were contemplating in the past, but definitely broadened areas for contemplation. So while we think that the conference was successful from engagement point of view, I don't think we are anywhere near solving all the problems that are facing us. But we definitely have started the much needed dialogue on some of these issues.
Well, Dr. Mothudi, beyond a dialogue, there is also a need for action. Now, if we go back to the prescribed minimum benefits as an example, which, according to policy, should be reviewed every couple of years, there's been no movement in this regard for almost 20 years, or at least since 2003, and that's 19 years ago.
It is disappointing, especially because the funders in South Africa view this as one of the major cost drivers. This was also articulated in the health market inquiry, which you may remember that in 2019 released its report and recommendations. We think that those areas deserve urgent attention, and there are some in the regulatory phase that need to be looked at. Well, we examined why there could have been a delay, and there are a number of opinions around this, whether there is political will, whether there is a capacity within the regulatory space to address this. It is interesting as well that during the deliberations at the health market inquiry, this matter was brought up, and it seems like the advent of the introduction of national health insurance has actually had a negative impact on some of these areas that need to be shown up. And so we definitely have to make sure that we address everything else. I think one of the things that we acknowledge as well is and this was echoed by Minister Pasha, that implementation of NHI does not solve everything that we need to look at as far as healthcare is concerned. So there is a commitment, at least from our side, and even entities like the Competition Commission, to urgently look at these matters that are regulatory in nature and to fast-track their review, because they do actually take away or deny access to millions of health citizens in our country.
Now, you raise the issue of national health insurance, and what we do know is that the Zambians have recently introduced their own NHI and have been fairly successful over the last couple of years. Now, Zambia was represented. Did you have conversations with them on how they've managed to implement their national health insurance? And what are some of the other key learnings that you would have picked up from some of the delegates, particularly those that were coming from beyond our borders?
Yes, we were fortunate to have Zambia represented by the head of their health insurance akin to our NHI, and definitely valuable lessons that we can get from their deliberations. Top of the list was the issue of political will. There's also the notion that we need to make sure that our processes are all inclusive. While we are solving the challenges facing us, we should not be polarizing in our nature and say it's a state project or maybe private sector has got no bearing. We should at all times seek engagements that are more collaborative. The other issue is how we communicate this to the health citizens so that they actually embrace the process and begin to understand what we are trying to do. The issues of resources will always be a factor. And we also had from another presenter who was looking at UHC systems outside of the continent even. And the issues that we sometimes articulate about resources not being adequate, a lot of the countries were actually able to implement them in a progressive manner without waiting for a time when the economy is flourishing. In fact, most of the examples that we heard about were implemented when the countries were under one crisis or another. So there were definitely valuable relations that we actually appreciated that much closer to home. We had from the Zambian experience, and definitely many lessons that we can take from there.